Dr. Halberstadt, could you talk a little bit about alcoholism?
Yes, alcohol begins with enjoying the effects of alcohol. People who drink believe that they are more creative, more enjoyable, not anxious, and people enjoy them more when they're drinking, and they feel very, very good. However, some people become so dependent on that they structure their social life around drinking.
Okay.
What happens is that as a person drinks repeatedly, the person alters oneself because it's overlearned, repeated experience. So there's a whole set of attitudes, issues of morality, acting out behavior that becomes part of oneself. When you're drinking, your judgment is impaired, but those become your beliefs. If you drink often enough, those beliefs become steadfast. So in effect, an alcoholic has two personalities, literally. He's got the sober personality, and he's got the alcoholic personality. A person drinks not to get drunk. A person drinks for this addictive personality to emerge because they're comfortable with that, because it's overlearned. So actually a person has two personalities, a sober personality and an alcoholic personality, which is genuine. However, there's an interfacing between the behavior when one's drunk, for example, being antagonistic, being seductive, being careless, violation of one's morals by acting out behavior like being promiscuous. But that will interface with the sober self because you can't keep the two experiences totally separate with action. So the sober self is altered in a negative way. It's very difficult for alcoholics to give up the drinking because that's who they are. It's a struggle, and that's why alcoholics relapse. If a person stops drinking and doesn't have personal interests and gets bored, he'll go back to drinking. Or if there's a crisis, go back to drinking. Now what happens when a person relies on alcohol, he doesn't develop a personal life because it's all around drinking. He's not interested in reading, he's not interested in playing cards, he's not interested in skiing, he just drinks. And so alcohol is very, very destructive. It also destroys the health. But studies have shown that an alcoholic's life is shortened by 10 years because alcohol destroys the body. And also there's a high rate of suicides at the end point of alcoholism, along with depression. Because in the long run, the person is not enjoying the alcohol because he becomes very troubled because he isolates himself, or she isolates himself.
Interesting. So how would you approach a patient? What would someone expect to come see you for counseling who feels that they might have a problem?
Counseling of an alcoholic is a long-term practice. This is not short because you have to take this altered personality. It's a very, very slow process. The person has to be committed to it. Often people are not committed to it. They don't know how to change, and the prognosis is generally not good.
So it's hard work.
It's hard work, but they have to be highly motivated.
Okay.
And expected to have relapses.
Okay. Well, thank you for educating us. And on a practical note, you take most insurance?
Yes, I do. I'm
And
provided for most insurance.
great. And if someone wants to get in touch with you,
It's 248-457-9667.
thank you, Dr. Halberstadt. Until our next segment.